Welcome to Primetime Health, your go-to channel for tips, guides, and information to live a healthier, happier life. Today, we're diving into 11 essential health screenings you should schedule this year to stay on top of your health and catch potential issues early. Let's get started. Health screenings are more than just routine checkups. They include physical exams, blood tests, and other procedures that help detect diseases and chronic conditions early, sometimes even before you notice symptoms. Early detection can improve your treatment options, reduce risks, and even save lives. Most health screenings are covered by insurance, Medicaid, or Medicare, so there's no reason to delay. But which screenings do you actually need? Let's break it down. First up, general health screenings that everyone should be aware of. Number 1 is the cholesterol check. Cholesterol is a waxy substance in your body that comes from both food and what your body produces. Too much of it can clog your arteries, increasing your risk of heart disease and stroke. A simple blood test can tell you if your cholesterol is too high. Most adults should have this checked every 4 to 6 years. But if heart disease, high cholesterol, or diabetes runs in your family, you may need more frequent checks. A quick tip for this one: don't eat or drink anything except water for 8 to 12 hours before your test for the most accurate results. Number 2, blood pressure screening. Your blood pressure tells you how much force your blood puts on your artery walls. High blood pressure or hypertension is very common and often has no symptoms, which is why regular screenings are so important. Most adults should have their blood pressure checked at every single healthcare visit. You can also check it yourself at home or at pharmacies using digital monitors. It's a quick, easy, and vital part of knowing your health status. Third on our list is the diabetes screening. Diabetes affects how your body processes blood sugar. If it's left untreated, it can lead to kidney disease, heart problems, and vision issues. A fasting blood glucose test can determine if your blood sugar is in a healthy range. Adults who are overweight, over the age of 45, have a family history of diabetes, or certain conditions like gestational diabetes or PCOS might need more frequent screenings. And fourth, let's talk about mental health screening. Your mental health is just as important as your physical health. Regular screenings for conditions like anxiety and depression can help you get early treatment and improve your quality of life. Most adults may get a mental health check at their annual physical, often using a short survey. And since about 75% of mental health conditions begin by age 24, screenings can start early in life. Remember, there's no shame in seeking help. Now let's move into the crucial category of cancer screenings. First is the mammogram. Mammograms use X-rays to detect breast cancer early, often before symptoms even appear. Early detection leads to more effective treatment, which is why this is so important. A little tip: avoid wearing deodorant on the day of your mammogram. Most people assigned female at birth should start regular mammograms at age 40 and continue every other year. Your doctor might recommend starting sooner if you have higher risk factors. Next is the cervical cancer screening. Pap smears and HPV DNA tests check for cervical cancer and precancerous conditions. Pap smears use a small brush to collect cervical cells, while HPV tests detect high-risk virus types. You should start Pap smears at age 21, and if your results are normal, you may repeat it every 3 years. Screening schedules can change after age 65, so always consult your provider for a personalized plan. Our third cancer screening is the skin check. Skin cancer is the most common cancer in the U.S. During a skin check, a dermatologist examines your entire body, including your scalp and the areas between your toes, for moles or sores that don't heal. Here is a tip: skip makeup or lotions on the day of your skin check so your doctor can get a clear look. Yearly skin checks are common, but those at higher risk may need more frequent exams. And number 4 for cancer screenings is the colorectal cancer screening. These screenings include stool-based tests or visual exams like colonoscopies. Stool-based tests are usually done every 1 to 3 years, while colonoscopies are typically every 5 to 10 years. Adults with average risk should start screening at age 45. Those with a family history or inflammatory bowel disease may need to start earlier. Adults over 85 typically do not need these screenings. A very important tip: follow your doctor's preparation instructions carefully, including any dietary restrictions and laxatives before colon exams. It makes the procedure much more effective. Alright, let's move on to screenings for some specific conditions. First is the bone density test. This test measures minerals like calcium in your bones to detect osteoporosis, which causes weak and brittle bones. Women should generally start after menopause or at age 65, and men at 65 or older. DEXA scans are the standard test. If your bone density is low, medications like bisphosphonates may help prevent fractures. How often you need this test depends on your risk, usually anywhere from every 2 to 15 years. Next, eye and vision tests. These are probably the screenings you're most familiar with. Vision screenings check how well you see up close and far away. Adults aged 18 to 64 should have exams every 2 years, and adults 65 and over may need annual exams to check for age-related changes like cataract. Keeping your vision sharp is key to your overall quality of life. And finally, hearing tests. Hearing loss is very common in adults over 60. A screening involves listening to sounds with headphones to check your hearing range. Adults 50 and over should get tested every 5 years, and those over 65 should screen every 1 to 3 years. Catching hearing loss early can help you get the support you need, like hearing aids, to stay connected with the world around you. So what about the costs and insurance coverage? Health screening costs can vary. Vision or hearing tests are usually less expensive than major cancer screenings. Some screenings, like a blood pressure check at a local pharmacy, might even be free. The great news is that many essential screenings are covered by insurance, Medicare, or Medicaid under preventive care. It's always a good idea to check with your insurance provider to see which ones are included in your plan and ask about any potential out-of-pocket costs. Don't let cost be a barrier to taking care of your health. And there you have it, 11 essential health screenings you should consider scheduling this year. Remember, staying on top of your health isn't just about feeling good. It's about catching problems early, improving your outcomes, and living your best life. Your health is your greatest asset, so be proactive and make those appointments. Thanks for tuning in to Primetime Health. Don't forget to like, subscribe, and hit that notification bell for more health tips and guides. Stay healthy, and we'll see you in the next video.